Hey guys, welcome back to Jen Loves Nursing. My name is Jen and I'm a nursing student. I'm back. Look, another story, another time, but today's going to be a lighthearted video. One I wanted to make for quite a long time, but I didn't really feel like I was ready to make it because it wouldn't have been fully accurate. I just wanted to make it because I wanted to make it because everybody else makes them and I want to make one. But I can make it now because it's totally accurate. It is the what's in my clinical bag? And this is my clinical bag. It's a backpack. I used to work at a behavioral hospital, this one right here. And the best part about becoming an employee of this behavioral hospital was we got this sweet OGO backpack. And it is the best backpack ever. So before I get started, I just want to introduce my new little puppy. His name is Ryder. And I love him so much. He came to live with us over the holidays. We were Santa Claus shopping, and this little boy walked into GameStop with these two dogs, like one in each hand, like one in this arm and one in this arm. This one was like him, his blonde, it's him obviously, blonde, and the other one was a little black one. And he's a Doshador. He's half Dotson, half Labrador. He's even got like the little lab wings on his back. He's just such a good boy. Oh, he's like almost 4 months old now. And I love him so much. And he thinks I'm his mommy. And he's so sweet to me. And oh, I just can't resist. Anyways, it's Ryder. And he'll be here. And I'm totally unimpressed helping me do this video. That's Ryder. Okay, so what's in my clinical backpack? Backpack, whatever, right? Okay, so, I'm going to start with the big pocket first because the big stuff is in it. Okay, first, and very important, nursing quick check diseases. I find this book to be so helpful. My Cardex, one of the pages in my Cardex includes a patient versus textbook. We have to compare the patient's disease textbook we have to compare the disease to what the patient is exhibiting symptom-wise, diagnosis, treatment-wise, and do a comparison, like a side-to-side comparison, and then principles of care. And this literally, let me just randomly flip through Parkinson's disease. I actually did this one today. How random. And it has everything in here from the pathophysiology, causes, risk factors, common characteristics, assessments, physical findings, treatment, nursing considerations, and patient teaching, and it's everything we need for that page. And I love this book. Oh, Amazon tip. I got it on Amazon for about $47. Hashtag no spons. Hashtag I love to be spons. It was about $47, but I have Amazon Prime, and had I known this trick first, I would have gotten it for like $8. And I've even seen it for less than that. When you go on Amazon to look for a book, it'll say like Nurses Quick Check diseases, $47.95, and then a little thing under it will be like, it'll say 12 used and new, starting at $8.47. Okay, and click on that little, it'll say for however many, 14 used or whatever. Click on that little bit, it's like a little bitty thing, click on it, and you'll be able to go to all the prices, even less than the new one. Like, do you really need a new one? And just so you know, I've had friends in class order it that way, and they've come brand spanking new. And they said they were like new, and they were totally new. Love that book. We have to do a write-up on all of our patients' medications, well, all of their 9 o'clock meds. And, of course, Dave's Drug Guy, couldn't live without it. Mine's got duct tape on it. It's like prophylactic duct tape, just preventative. Because almost all my other books, oh, I have an example right here. They broke from overuse. This is my Rosdolls. And it was so big that it had to go into 2 spirals. And this is that's how big it is. And yeah, but it's better than having a broken book, I say. Okay, I have this very cool, what is it, white coat clipboards. It's a clipboard, it's got all the nursing quick checks on it, like quick reference stuff, from like pupil size to injection sites to like chem panels, normal ABG, stuff like that. I find it handy, and really I like this part because I can just stick it in my pocket. I like it. This is just like a little plastic folder from the financial aid office. It's full of all my Cardex papers. Our Cardexes are about 6 pages long at minimum. And that's because our medication page holds 3 meds. There's enough for 3 write-ups on there if your patient has more than 3 meds, which I'm working with all old men, like mostly older men. They all have lots of meds, so you could, on average 2 or 3 med pages. So usually my Cardexes are about 9 pages long. Gotta have lots of copies. The worst thing you can do is show up to clinical late, don't call, or not have Cardexes. Well, not being prepared. My instructor says we have to keep our clinical notebook within 5 minutes of us at all times. This is my clinical notebook. It says to be checked off because once a Cardex is complete, we then store it to be checked off, and then she's graded it, it's done, but then it's our responsibility to make sure whatever checkoffs we have for that day, like I got to administer via PEG tube the other day. We do a lot of write-ups on specific medications. I did carbidopa, levodopa. I did a anti-Parkinson medication. I have to do a full meta-analysis on it, and then it's my job after she grades it to give it back to the DON, and she checks off, okay, you have that check off. They have told us over and over, you can be a straight A student in theory, but if you don't pass clinical, you don't pass the program. And this yellow part right here, this colorful one, that's the actual, like, notebook. I'm not going to show you it because I don't want to get in trouble, but this is like the actual notebook, and the rest of them are Cardexes that need to be checked off. Well, some of them are, some was just plastic. Oh, they're all back here. They're all back here right now. So y'all, next, this is my incomplete to be fixed clinical Cardexes. I know you're probably thinking, Jen, you're getting a little like anal retentive now, but it just keeps me organized. I like to be organized in my own head. Sometimes it's hard for me to move on to something else because I feel the weight of incompleteness, that's not even a word, on my shoulders. Like today I had to go to the hospital. We're allowed to go to the hospital off duty and look up medications in the medical library, and although it wasn't something I needed to do necessarily tonight, I felt an urgency to do it, so I had to get it off my shoulders. It's my OCD. This is incomplete to be fixed clinical Cardexes. So we have clinicals on Monday and Wednesday, and they are due completed the next Monday. So until they're red means I need to go back. Red means they need to be fixed, and then black means they are done, ready to be turned in. Yes, they are. That's all for the big portion. Okay, so the little pockets. I have my charting policies and procedures book. This book has gotten me through a plethora of clinical. It's just a little bit of everything. Terms pertaining to the body as a whole, right hypochondriac region. It's charting procedures. Our program is huge on charting. So much of the time, nurses don't learn how to chart, and that is one thing I am stellar personally at. I love charting professionally, and it gave us charting helps in here, system assessment from going through the entire body. We get these when we start clinical. This is my little bag of important stuff that I keep in my pocket at clinical. It's like a tape measure, some tape. Okay, don't make fun. Okay, yeah, it's kind of big. It's kind of bright. Ooh. But it gets the job done, okay? It gets that job done. I got actually 2 pairs of scissors in here. My carp ejects, which I've yet to actually use. A bunch of alcohol pads. And something that doesn't need to be in there. Okay, so yeah, that's what's in there. And that I actually keep in my pocket because it's just so much stuff that stuff just gets kind of lost in my pocket. So I'd rather just keep it all together. I have some lotion because I'm washing my hands constantly. Some more lotion. What is this paper? You're getting the raw truth. I've not cleaned anything out. Oh, I need to get a new badge. More alcohol preps. You know how tourniquets, IVs, stuff like that. You know how you just end up with stuff in your pockets after clinical? Yeah. Post-its. I have saline flush in here. Pencil, lead. I don't even know why I don't even use it. I have not used it. I don't use pencil at all. Earplugs. I kept these in here because our reproductive final was done at the hospital, and I got these out of the cupboard to put in my ears for the final, which I have a final Tuesday. I should put these in my other notebook, in my other bag. Various little notebooks for report. And then this thing, I use it for wounds. I try. The idea was that I wanted to use it for wounds, so I have it in there. Highlighter. What else? Oh, toothbrush and toothpaste, because I'm kind of anal sometimes. I just want to brush my teeth, man. An open saline flush, not because I've used it, but I think I was like cleaning my contacts with it. This little notebook, I started doing like, what was it? Skills, like putting skills, writing them down in here, because whenever you do a skill, my instructor says you have 5 seconds to tell me, 2 minutes to tell me what supplies you need, and whatever. More Post-its, another toothbrush. Oh, it's my my micro shield for CPR, just in case. It's a syringe. Some bobby pin. Oh no, not bobby pins. Oh my gosh, it's a needle. Some insulin needle. See, stuff just gets left in your pockets at clinical, man. This whole pocket is just full of pens. Pens, hospital lotion, and more earplugs. Let's see what else. Get into the little pockets here. Body wash, gum, bigger tape, chapstick, tabbies, which are very important for us. We use tabbies when we pass meds. We use tabbies for everything. My badge. I should put that in a little pocket, actually. I'll put that up here. Oh, no, I'll put it in here. My badge. Oh, my gosh. More chaps. Oh, that's not chapstick. More chapstick. Whiteout, which I do not use on paperwork. I use some like Cardexes, not on the flow sheets. Not the Cardexes at school or clinical. This is like my own paperwork. Safety or bobby pins. What are these? Paper clips. More Post-its. A hairbrush. So that's really it. Thank you for watching my video, and thanks for all my new subscribers. Thanks for sticking around waiting for me to come back. I'm going to be here. I have another video planned that I think I may film soon about the reason why I've been gone. And yeah, hopefully you guys can get something out of it. I really appreciate all the support you guys have given me. I have about 4 months left in nursing school, and I'll be a nurse. I'm super excited. So, keep on nursing. Bye.